If you've ever wondered what are the symptoms of constipation, then stay tuned because this video is for you. Constipation is a common digestive problem characterized by infrequent or difficult bowel movements. The severity and specific symptoms of constipation can vary from person to person, but here are some common symptoms and signs associated with constipation. Infrequent bowel movements. One of the primary symptoms of constipation is a significant decrease in the frequency of bowel movements. For some people, this may mean having fewer than 3 bowel movements per week. Difficulty passing stools. Constipation often makes it challenging to pass stools. The stools may be hard, dry, or lumpy, making them difficult to expel from the body. Straining. When trying to have a bowel movement, individuals with constipation often strain or push excessively to pass stools. This straining can lead to discomfort and sometimes even pain. Incomplete evacuation. Feeling as if you haven't fully emptied your bowels after a bowel movement is another common symptom of constipation. You may still feel the need to go afterward. Abdominal discomfort. Constipation can cause abdominal discomfort or cramping. This discomfort is often described as a dull, aching sensation in the lower abdomen. Bloating. Many people with constipation experience abdominal bloating, which can cause a feeling of fullness and discomfort. Rectal bleeding. Straining during bowel movements can sometimes lead to small amounts of rectal bleeding. However, if you experience persistent or heavy bleeding, you should seek medical attention immediately, as it may indicate a more serious issue. Hard or small stools. Stools in constipation are typically harder and smaller in size than usual. They may also be dark in color. Decreased appetite. Constipation can sometimes be accompanied by a decreased appetite or a feeling of fullness, which can lead to reduced food intake. General discomfort. Overall discomfort and a sense of unease may accompany constipation. This can affect a person's daily activities and quality of life. Most asked questions about constipation symptoms. What is constipation? Constipation is a digestive condition characterized by infrequent bowel movements and difficulty passing stools. It can result in hard, dry, or lumpy stools. How often should I have a bowel movement to be considered normal? The frequency of bowel movements varies from person to person, but generally, having 3 bowel movements per week or more is considered normal. However, some people may have daily bowel movements, while others may have them less frequently without any issues. What are the common symptoms of constipation? Common symptoms of constipation include infrequent bowel movements, difficulty passing stools, straining during bowel movements, a feeling of incomplete evacuation, abdominal discomfort or cramping, bloating, and hard or small stools. What causes constipation? Constipation can be caused by various factors, including a low-fiber diet, insufficient water intake, lack of physical activity, certain medications, medical conditions, such as irritable bowel syndrome or hypothyroidism, and ignoring the urge to have a bowel movement. When should I be concerned about constipation symptoms? Occasional constipation is common and often not a cause for concern. However, if you experience persistent or severe constipation, or if it is accompanied by symptoms like abdominal pain, rectal bleeding, vomiting, or unintended weight loss, you should seek medical attention, as it may indicate an underlying medical condition. Can constipation be relieved with dietary changes? Yes. Dietary changes can often help relieve constipation. Increasing fiber intake by consuming fruits, vegetables, whole grains, and legumes can promote regular bowel movements. Drinking plenty of water and staying physically active are also beneficial. Are there over-the-counter medications for constipation? Yes. There are over-the-counter laxatives and stool softeners available to help relieve constipation. These medications should be used as directed and not for extended periods without consulting a healthcare professional. Can stress or anxiety contribute to constipation? Yes, stress and anxiety can affect the digestive system and potentially lead to constipation. Managing stress through relaxation techniques, exercise, and stress reduction strategies may help alleviate constipation. Is chronic constipation a sign of a more serious health issue? Chronic constipation can be a symptom of an underlying medical condition, such as irritable bowel syndrome, IBS, thyroid disorders, or colorectal problems. If constipation persists for an extended period or is accompanied by concerning symptoms, it's important to consult a healthcare provider for evaluation and diagnosis. Can constipation be prevented? Constipation can often be prevented by maintaining a well-balanced diet rich in fiber, drinking plenty of water, staying physically active, and responding to the urge to have a bowel movement. Establishing healthy bowel habits is key to prevention.